Every year, thousands of people undergo arthroscopic knee surgery hoping to walk, run, and move pain-free again. But what truly determines how well you recover isn't just the surgery, it's what happens after. The rehab process can make or break your recovery journey. If you've ever wondered how athletes bounce back so quickly, or how to rebuild strength without risking another injury, this video will walk you through the doctor-approved rehab plan that actually works. Right after surgery, the goal is to reduce swelling and restore gentle motion. Ice, elevation, and ankle pumps help prevent stiffness. As pain decreases, physical therapy becomes your best friend, starting with simple range of motion exercises, then progressing to strengthening your quadriceps and hamstrings. Balance and flexibility training follow, helping your knee regain stability. Consistency is key. Skipping rehab days can delay healing. Most people return to normal activity within weeks, but full recovery can take months. Patience and precision make all the difference. Remember, surgery fixes the problem, but rehab restores your strength. Stick to the plan, listen to your body, and your knee will thank you for years to come.